Hello, my name's Richard Donati. I live in Barre, Massachusetts. I currently work at the Department of Corrections.
Great, thank you so much. And I'm Dr. Mexico. I'm back again with another one of the all-star patients that went through my peripheral neuropathy program. Rich is a patient of mine. He's graduated from my peripheral neuropathy program. Rich was suffering from peripheral neuropathy, not diabetic neuropathy. So we're so accustomed to people who have peripheral neuropathy nowadays. We're so accustomed to it being from diabetes that we actually refer to it as diabetic neuropathy, but Rich's was not from diabetes. Why don't you tell them a little bit about your story and how you got the peripheral neuropathy in the first place?
Back in 2008, I was diagnosed with acute leukemia, and at that point, I went in and they did aggressive treatment. And one of the drugs called vincristine was known to cause peripheral neuropathy, and they had actually never seen it quite as bad in any patient as they did in me.
Okay.
And that's how I got my neuropathy.
So his was a post-chemotherapy agent peripheral neuropathy, which is the second most common peripheral neuropathy that I see in my practice. Number one is diabetes. Number two is post-chemotherapy induced peripheral neuropathy. It's a very, very common side effect. And in your case, according to him, one of the most severe cases of peripheral neuropathy they had ever seen from this specific medication. So what meds did they have to put you on in order to try to manage your peripheral neuropathy symptom? Let's go over the meds and the dose if you remember.
Let's see. The morphine I was taking, I believe it was 15 milligrams in the morning and 5 milligrams at night.
Okay.
That was when I met you. It was a little bit higher when I first started.
Okay.
I was getting 240 oxycodones a month, 5 milligrams.
Okay.
And I was doing 600 milligrams of gabapentin 3 times a day.
Okay. So we were at 1,800 milligrams of gabapentin, morphine, and oxycodone to manage the peripheral neuropathy. Now, to be clear, when Rich came to see me, his only goal, because those meds were managing your symptoms relatively well, right?
Absolutely.
But his goal was, keep me feeling this way, but get me off the drugs if you can. Is that correct?
That's exactly what I wanted.
Okay, so as of today, how are the meds?
I am off all meds.
No more morphine.
No more morphine,
No more gabapentin and oxycodone, very rarely for like rescue type pain if you're out on a long day. And the pain in your feet, is it the same as it was when we started, or is it even better than it was when we started?
It's even better than when we started. When I saw you, my pain level was a level, I called it a 3.
With the meds.
With the meds.
Right. Without the meds,
Without meds, I was a 9.
Okay.
I couldn't. My hope was to keep that pain level and try to get off all meds. I would say my pain level now, on most average days, is a 1.
Okay. So without meds, he wasn't even able to function, a 9 out of 10. Now, without any medication at all, a 1 out of 10.
I would say, unless you're satisfied where you are in life, taking the drugs, having to spend the money, having the withdrawals if you missed your drugs or anything, that this is worth a try. I thought, the doctors told me, you're going to have a lifetime of pain and you're going to have a lifetime of taking these meds. And I was not willing to accept that. And it was a godsend.
I appreciate that so much. I'm so happy for you. Rich was very skeptical. In fact, he and I went back and forth a little bit on Facebook when he saw my advertisement. And I think I remember one of the posts was, I don't know about this doc. I can't even find him online. This thing probably isn't real. And he was looking me up under the wrong name.
Yep.
But thank you so much. I really appreciate it.
Yep.
Anything else that you want to say? Anything at all that you want to say? I'm thrilled.
I can just say one thing, that when I first got out of the hospital with my neuropathy, I was unable to walk more than 10 feet. It took me months to be able to get off of my first floor and to go up the stairs. And that's how bad the neuropathy was. It's well worth, no matter how bad your neuropathy is, this is worth trying.
Thank you so much. I appreciate it. Thank you a lot.
You're welcome.
All right. All right, so this is Dr. Mexico again, and I hope this was informative for you, and I hope somebody out there is able to take his story and use it for your own benefit as well. So make it a great day.